to the EMS director about this today. About a month ago, I was on the phone with two friends of mine who are doctors in Florida, and they were saying that hospitals there were completely overflowing. And I said that is not at all what we are experiencing on the West Coast. At the time, the Delta variant really was not surging here. We were all A-okay. Fast forward to today, the EMS director told me that there are 314 patients in the hospital now, whereas a month ago, when I had that conversation, there were just 39.
The normal calls and patients that they normally see have no place to go in the emergency rooms in the hospital because COVID patients are taking up those spaces.
With coronavirus patients filling up hospitals, there's sort of a domino effect happening. Patients who don't have beds to move into the hospital stay in the emergency department. Then there are fewer beds available for emergencies. That means people have to wait longer in the ER, and it means ambulances can't drop off patients. The longer ambulances have to wait at the hospital, the longer they're unavailable to go out to new 911 calls.
Trying to avoid utilizing the emergency department and ambulance system is extremely important in order for us to protect that healthcare system for the people that really need it.
The county is asking that you only go to the ER or call an ambulance if there is a threat to life or limb. What are some examples of things that people might be going to the ER for where they really should be going to an urgent care center or even their primary care provider?
There's a lot of people that just feel ill. And that could be, unfortunately, from the weather. They may have a minor injury, a cut, things like that. Those aren't things that need to go to an emergency department.
Telehealth is another option the EMS director recommends. So as I mentioned in that story, it is a huge problem that COVID positive patients are filling up the hospital, but COVID positive staff is another problem that's stretching hospitals thin.
We want to take measures right now to keep our kids in school and keep our staff working.
Despite protests from parents earlier this summer, Visalia Unified began the new school year requiring students to mask up in the classroom. And starting Wednesday, they'll need to do it outside, too, following an increase in COVID-19 cases among students and staff.
What we learned is most of the contacts that happened were contacts where masks weren't in place. So whether it happened at recess or happened in an environment where there was not both students or staff wearing masks.
According to a district spokesperson, 4 classrooms have been quarantined so far, and a, quote, significant number of teachers are out too.
Before this even started, we're having a shortage of substitute teachers. So every single teacher that is not able to come to work because of quarantine is having a tremendous impact. We're pulling staff from across the district and teachers on special assignment to cover classrooms and try to continue instruction in the classrooms.
I know in hearing this news, some parents may have that concern pop up that, oh my goodness, here we go again. Am I going to have to do online schooling with my child again?
We know that one of the things that's critical for our community is to keep kids in school, keep them learning, but also to allow our community to get back to work. So we are making these decisions based on what we believe is best for kids. And I know some of the decisions are not always popular with the adults, but it's really about doing what's best for our children at this point and keeping them in school and keeping them safe.
Assistant Superintendent Cardoza tells me that administrators visited school sites last week and found about half of the students were already masking up outside. He adds that the district will continue offering vaccine clinics to staff, and it is in the process of offering vaccine clinics to eligible students too.
Why do you need healthcare recruits, and what kind of opportunities does the Army offer?
Well, I'll leave it to Sergeant Rodriguez here to tell you about some of the opportunities. I can tell you that healthcare is something that we need across the spectrum in the civilian world and the military. And you'll find right now a lot of the civilian activities are being complemented by military healthcare. So there is no such thing as military healthcare that is exclusive for military. They are a service that is provided to the nation as a whole.
The opportunities that you have in Army healthcare come in both part-time and full-time positions in fields like medical, dentistry, nursing, and allied health. We are looking currently for family nurse practitioners, critical care nurses, entomologists, biologists, and even environmental engineers. We're giving the opportunity for providers and healthcare students to not only have a career that's giving back to their local community, but to have a significant impact on soldiers and their families and our veterans.
Where would they end up working?
That could be a variety of different positions. So in part-time, like I had mentioned, that's Army Reserves. They can continue to work in their civilian profession, whether it be a hospital, clinic, or their own practice here in their local community in Fresno or other surrounding communities, and still go into an Army Reserve unit and work 1 week in a month and 2 weeks out of the summer. That job could take them abroad or even locally to a Army unit that needs their assistance here in the States.
Wow. Okay.
So, a lot of opportunities there.
It does, yeah. Okay, so Lieutenant Colonel Rios, how is the Clovis Memorial District supporting this medical recruiting mission?
You know, Kim, that's a great question. The Memorial District, was established in 1946 to welcome our heroes home from World War II. And it's been really a great community center ever since. I consider it the crown jewel of the valley. All the major events take place here. Because it's such a central location, one of the things that we've done is to reach out to them and to make their services available here with the California Health Services University here opening up. We've got such great state-of-the-art medical facilities. What my personal goal was to see about getting some of the scholarships and opportunities that they offer brought here so that we can, one, facilitate more of our community members who aspire to pursue a medical degree of some sort or to go into the health field but aren't aware, or perhaps cost is prohibiting them from even entertaining that idea, by partnering with them and bringing them over here and making it so centrally available to everyone. That's where the Memorial District has been able to continue its mission in honoring service by also making all of these opportunities available to the community at large.
It's Staff Sergeant, if somebody's watching now, they're in the healthcare industry already, or they're students, what is the first step they should take if this is intriguing them?
Absolutely. So the very first step would be to contact us at the San Francisco station. Our office covers the Fresno area as well as all the way over to the Nevada border. And programs that we have available are dozens for healthcare professionals and students. People who are looking to get advanced degrees, as Mr. Rios said, some scholarships, even financial assistance and internships. We are currently looking for positions to fill in our clinical psychology internship program, our Masters of Social Work program, even the social work internship program. We have an option for dietitian students that are looking to get their masters. And our most popular scholarship is a 100% tuition paid scholarship for both medical and dental students.